Yeah. So today we are celebrating Women's Day, and this is an initiative by Indian Association of Physiotherapists, a professional body representing physiotherapists from all over India. And uh, we are in conversation for the Women's Day program with Dr. Rajini Patil, who is a globally trained spine and sports physiotherapy specialist with over 24 years of clinical experience. She has a Doctor of Physical Therapy degree from Arizona School of Health University and holds multiple international certifications, including certified McKenzie practitioner, Maitland manual therapist, and sports injury and rehab specialist. She has her own clinic, Orthosports Physiotherapy, at Mumbai. And beyond her clinical leadership, she is also a passionate educator and speaker. She is also a mother of two and finds joy in trekking, traveling, and reading. Her mission is simple and powerful to help people live pain free, active lives through smart and preventive care. Let us see and help understand how physiotherapy can help women according to her. Thank you, ma'am.
Thank you. Good
Good evening, ma'am. We'll be starting with your
evening.
first question.
Sure.
With over 24 years of experience in spine and sports physiotherapy, how has your clinical approach evolved, especially with the integration of McKenzie and Maitland concepts?
So, I've been practicing now for more than 24 years. My first 10 years, 8 to 10 years were in the US, where I was primarily with outpatient ortho departments and clinics. And as every clinician, I feel when we first start practice, the focus is on pain relief. And over time, I have realized that every patient is so very different. And yes, they do need pain relief from us. That's why they're here. That's one of the primary things that we look at. However, the patient needs to be looked at as a person, as a holistic person. And what this individual needs is what I gear my treatment towards now. In fact, my clinic is in Shivaji Park, Mumbai, and my junior physios, I always tell them on day one, do you ask what your patient's goals are? Your goals are very clear. You want to get the patient better. However, do you know what the patient wants? Do you know whether they want to trek, whether they want to run, whether they just want to be able to climb stairs without pain? So, this I feel patient centric, result based treatments is an approach is what I think I have evolved over my years of practice. Now, you know that I am a spine and sports specialist. So, in spine, I end up using McKenzie as my primary assessment tool. And from where my treatments evolve into other things. As a physio, we have a lot of different tools in our skills, and every individual patient that comes in needs something else to get them better. So even though when I'm treating spine, my spine or joints, I'm starting from McKenzie and making them independent in their approach towards getting better, but also looking at Maitland and what kinds of manual therapy is going to get them better faster and back to movement faster.
Very well explained, ma'am. Moving to the next question. As a spine specialist, what are the most common spinal health issues you see in women today? And how can physiotherapy help in prevention and long-term management for the same?
So, women actually come in with various different problems, a different set of issues, all the way ranging from postural issues, which is coming from either their sedentary life at work or coming from standing for too long, either at home, um, core not being strong, and just not prioritizing themselves enough to get treatment at the very early stages of problems. Also, the big thing that we see in women is, of course, now I see a lot of change in this. However, women, because their footwear is always an issue, that creates a lot of biomechanical forces going up to the knee and back, and that leads to problems. But now, of course, awareness is better. But neck, lower back, and knees, these are the most common things that I see in women today.
Yeah.
Right, ma'am. What inspired you to establish Orthosports Physiotherapy, and what challenges did you face as a women leader and founder in this field?
Uh, so, as you know, I practiced in the US for 8 to 10 years. When I moved back to India, of course, the approach in the US, the way we were treating, because I had also done my DPT, it was extremely evidence based. And partly it's because insurance just won't cover things that are not really research proven. So we would do very active therapy rather than passive. Passive was not used, almost nil. No modalities, things like that. So here, when I started practice and I was working for somebody else, I realized that the active approach was missing, and evidence-based approach was missing. So that's what motivated really to for me to start on my own, to be able to give the care that I thought the Indian population needs. Even though I do believe that for holistic treatment of the patient, it needs to be everything that the patient believes they need also. So some amount of modalities I do give. However, it's always based on education. I always make sure that they are educated on what are the things that are going to get them better faster. And what kinds of movements, instead of being afraid of movement, do the movements that are helpful. And of course, we are there to guide you through the process. And just being that encouraging and being with them makes a big difference. So that was one of the things I that was what motivated me to see each patient as an individual rather than a number or statistic. If you ask me challenges, you know that our field is quite women oriented. A lot of women practitioners, clinicians. There are men more in academia, in sports, on the field, and that's wonderful. But I feel as a woman leader, because a lot of the women look up to me, especially the young physios that graduate. There is this responsibility to make sure ethical practice is important, patient centric is important, rather than running after things that are flashy and new and just doing 10 types of modalities, because that really is a disservice to the patient. So, in that way, I wouldn't say that I have faced professionally a lot of challenge. Of course, growth for women always is dependent on the phase of life. As you know, I have two children, I have two teenagers. So, when they were younger, balancing home versus my profession, and then growing based on that flexibility that I had to give myself while looking after my family, that was indeed, of course, a challenge. But I think all women have that challenge. But otherwise, professionally, I don't think I have got a lot of challenge.
Again, beautifully explained, ma'am. That
Thank you.
brings us to another question. Now, being internationally trained and strongly committed to evidence-based care that you are, how important it is for a physiotherapist to continuously upgrade their skill and clinical reasoning.
So I think that as a human being, we are meant to keep learning, but for our profession, it's especially important because medical science grows every single day. So there is something new, something better that can help your patient. Every single day, something new you can learn. And now, of course, with technology, the world has become much smaller. So we are able to gain access to knowledge faster in a much more convenient way than before. But I remember even when I had moved here and I was practicing here, every year when I would go back to the US for a month or 6 weeks, I would always enroll for a course or something that I knew would help me grow professionally. So I think continuing education has to be, it's non-negotiable. That's how we learn. And of course, applying that to your clinical practice is very, very critical. So, especially in the first few years of practice, it's highly important. as you get older, as you become more and more experienced, the need doesn't go away, but then it goes more towards research and papers and things like that.
Truly said, ma'am, learning never stops for us.
Yes.
On this Women's Day, what advice would you like to give to young female physiotherapists who aspire to excel in clinical practice, specialization, and leadership?
So I think women are born leaders. I think all women have this in them. But my advice to the young physios, one is not to allow other people or society to dictate your ambition and what you want to do as a professional. It has to be centered to what you want. It doesn't mean that you need to do XYZ just to show somebody. It needs to be what you want. To be um, to be flexible and compassionate with yourself in the growing phases of your career, because every stage brings its own challenge for women. But for the young physios, I would say the big thing that I see when I'm interviewing or for my new staff, what I see is clinical reasoning and assessment is a skill that I think grows over time, but also it needs to be a center focus, because if your diagnostic skills, if your assessment skills are fast, and if you are bang on and if you can get it right very quickly, then the journey of you and your patient becomes so much easier. Um, in contrast, what I'm seeing a lot of physios do now is to run after certificates. Assessment is not so important. Assessment to aega they feel, but they want to learn new tricks, new treatment approaches. Nothing wrong with that. Nothing wrong with gaining certificates. That's okay. Do the workshops that are going to help you professionally, but it needs to be a little bit focused. I feel that if you have picked a field, you should know in the first 2 3 years of your professional career that this is the field that is going to work for me. For example, when I first started practice in the US, when I started I observed at several different things: cardiovascular, peds, MSK, sports. And then I realized that I can't do anything except for spine. I love treating spine, I love treating runners and sports. So that's what I went deep into. I don't even know anything. So if there is a neuro patient, I'm not going to see them, I'm going to refer them to a neuro physiotherapist. And I feel that is missing. We need to have our younger generation be go deep into the subject of what their specialization is, instead of running after certificates and becoming the jack of all trades.
Moving to the last question, ma'am.
Yeah.
What has been your most rewarding moment during physiotherapy practice?
If you see, actually, our lives are full of rewards, because every time a patient gets better and thanks you, every time I see a patient telling me that because of you, because of your team, I've been able to do this, which I wasn't able to, and the joy that gives it, all that is extremely rewarding. I think that's why we are in this profession. But to me, the greatest reward is when my patients tell me, my athletes and my patients tell me that, ma'am, आप है ना, हम सब कर सकते हैं. We can go on a trek, we can go dancing, we can run ultras, we can do whatever we want, because we know that if anything happens, you are there to take care of us. And that to me is really, really rewarding and fulfilling.
Beautifully said, ma'am. Thank you. We are done with all the questions.
Great.
On behalf of the IAP Women Cell, Maharashtra State, Mumbai District, I want to thank you, ma'am, for this wonderful interview that we have. My sincere gratitude to all who made today's Women's Day interview a grand success. Special thanks to Dr. Rajani Patil, ma'am, for sharing her inspiring journey, global experiences, and valuable insights on leadership and women in physiotherapy. Your words truly motivate us to strive for excellence. Our heartfelt thanks to Dr. Ruchi Vashni ma'am, Dr. Pooja Kamble ma'am for giving us this wonderful platform for this constant support, and a special appreciation to Dr. Suvarna Ganveer ma'am and the Maharashtra State IAPWC team for their guidance and unwavering backbone support. Also thanking Dr. Sanjeev Jha sir for his encouragement and support. Lastly, thank you to our coordinator, Dr. Deepika Viras ma'am, sub-coordinators, Dr. Reema, Dr. Ekta, Dr. Tejal, and Dr. Neha for bringing this beautiful, meaningful conversation on the event of Women's Day. Thank you so much, ma'am, for this wonderful conversation.
Absolutely my pleasure to be here. Thank you.
Thank you so much, ma'am, for giving us your this valuable
Yes,
time. And happy
most
Women's
welcome.
Day, ma'am.
Happy
Happy
Women's
Women's
Day to
Day.
all of you.
Happy Women's Day to everyone.
Happy
Can we
Women's Day.
please click a
Thank
picture?
you.
Yeah,
Yeah.
let's
Yeah,
pose, please. Thank you. Once again, thank you, ma'am.
Thank you,
yes, of
ma'am.
course. No
Bye,
problem.
ma'am.
All right. Thanks. Bye.
Bye.